And welcome back. A new warning for some older patients with diabetes, hypertension, and other conditions. Researchers now telling doctors they should actually be treated less aggressively than they commonly are. Dr. Samadi, why?
I'm so glad we're talking about this because I really think as we are getting older, we're over-treating some of these patients. We're talking about patients that are over the age of 75. And what I want is to really think about patient care as like the way the plane takes off when you're young, when you travel, and then when you land. Landing of a plane is when you were older. You have to slow down, doctors, in treating diabetes and blood pressure when you see 75-year-old, 80-year-old. The study from New England Journal of Medicine called Accord shows that when you treat diabetes among elderly too harsh, bring their blood sugar down, more falls, more mortality. So you need to slow down as the plane lands. Most of our effort as physicians should be when we are in youth, exercise, weight loss, good diet, etc. And then during the course of our life, in their 40s and 50s and 60s, that's when you want to treat, that's when you want to be aggressive. Once you get to 70 and 80, a blood pressure of 150 versus 140, no big deal. And study shows that even if your hemoglobin A1C is higher, for risk of diabetes, leave them alone. Don't over-treat, don't over-prescribe.
I don't look forward to landing. I don't want to land.
Well, you have
Eric, you're
still very young.
And he's in good shape.
But that's a good point. I mean, they also talk about pancreatic cancer, for example. If you're much older, sometimes leave it alone.
Well, pancreatic cancer is a very special case. Yeah. But let me say this, to talk about the things that were studied here, high blood pressure and diabetes. We're always talking about how to control these things here, but one thing we've never said on this show, and David was just mentioning this, it's more dangerous to be low than high. So everyone out there is worried that their blood sugar is too high, but when you get to be 80 and you're not eating properly and suddenly it goes low, you're going to end up in an ambulance in the hospital. Same thing with your blood pressure. Blood pressure goes low, I end up having to send you to the hospital. And this survey showed that only 19% wanted to change their blood pressure medicines if it was too low. Only 20% listened to their doctor who said, hey, your sugar's too low. Back off on your medicine. Backing off on medicine is even more important than medicating in the first place. But I want to add to this the caveat that yesterday's 70 is today's 60. I mean, look, people are living to older ages. I want them to get their flu shots. I want them to get their pneumonia shots. I believe strongly in preventative care. I still send people for colonoscopies at 80. Yeah. But this blood pressure medicine and the diabetes stuff is very life-threatening.
And also there's so many side effects with those 100%.
Medications. And I don't envy Marc, actually, because like once in a while I see some of the patients that come, and they really come with a bag of medications. The good thing about surgeon, we should be looking at all of the medications, but there are so many blood pressure medications that they're on, so many diabetes medications that they're on, and interaction of these. So find a good doctor who really goes through all of your medications and find out which one is absolutely necessary and which one you can just delete and
there are doctors who specialize in geriatric medicine.
100%. That's a good point.
To David's point about the plane, by the way, sometimes I feel like one medicine is counteracting another medicine, which is counteracting another medicine, and a lot of good geriatricians will say, let's stop half of these. You're on too many.
You know something? As a doctor, sometimes you have to say no. And when you see an 80-year-old guy that pushes his way through getting a prostate biopsy or PSAs, you have to say, if you've made it to 80, you're going to be fine. Enjoy the rest.
Enjoy the rest of the ride.
Very good.
Keep flying.
Keep flying.